Trypanosoma brucei is a parasitic bloodstream infection that is spread by the tsetse fly and is endemic to much of equatorial Africa. There are two stages to T. brucei infection, the hemolymphatic phase and the neurological phase. During the hemolymphatic phase, the parasite can be found in the blood and causes symptoms including fever, fatigue, and weight loss. During the neurological phase, the parasite crosses the blood-brain barrier and can be found in cerebrospinal fluid. This causes symptoms such as tremors, paralysis, and sleep-wake disturbances. There are also two different subspecies of T. brucei, T. brucei gambiense, more commonly found in West and Central Africa, and T. brucei rhodesiense, more commonly found in East and Central Africa. The two subspecies and the two different disease stages both have different treatments, so it is important to be able to diagnose the specific type of trypanosome infection which cannot be done by microscopy alone. Here, we will use a latex agglutination test to diagnose hemolymphatic or neurological infection of T. brucei gambiense. TB gambiense is detected in the cerebrospinal fluid using latex beads coated in antibodies specific for the trypanosome surface antigens LI-TAT 1.3, 1.5, and 1.6. If these antigens are present, they will bind to the antibodies on the beads and cause agglutination. TB gambiense is detected in the blood using latex beads coated in antibodies specific for IgM antibodies that are generated in the immune response to trypanosomes. If these antibodies are present, they will bind to the antibodies on the beads and cause agglutination. First, the latex beads are added to the agglutination card. It is important to make sure that the beads are not clumped at the bottom of the tube to avoid false negative results. A couple of drops in each circle are sufficient. It is important to not mix the two types of beads together, as this could cause confounding results. Positive and negative control samples will be added to the beads, as will two different patient samples. First, we will test the cerebrospinal fluid samples. Again, only a couple of drops are required. Latex agglutination tests are highly sensitive. It is important to not mix the samples together, as this could cause confounding results. Once all the samples have been added, mix the beads with a toothpick, remembering to use a fresh toothpick each time. Observe how the latex beads clump or agglutinate with the positive control. And observe the lack of agglutination with the negative control. Patient A is positive for neurological TB gambiense infection. Patient B is negative. These results are also shown in the online lab book. The same experiment will now be performed using the same beads to test blood from the same two patients as before. Take care when analysing these results, as the blood can mask the agglutination. Again, observe the agglutination with the positive control, and the lack of agglutination with the negative control. This time, both patients are positive for TB gambiense infection. Based on these results, which treatments would you prescribe for these two patients?